Matthew, thank you for spreading awareness, and I hope this video reaches a broad audience. Anton syndrome is a scarcely encountered ailment affecting individuals with impaired vision due to occipital lobe injury. The critical attribute of Anton syndrome lies in the fact that these patients remain oblivious to their blindness. Anton syndrome, also known as Anton-Babinski syndrome, is a rare neurological condition in individuals who have experienced damage to their occipital lobes, which are responsible for processing visual information. This condition is often a result of stroke, trauma, or other types of brain injury affecting the occipital lobes. One of the most remarkable aspects of Anton syndrome is that individuals suffering from it exhibit a profound inability to acknowledge their visual impairment. Despite clear indications suggesting their blindness, such as frequent collisions with objects and descriptions of non-existent items, these individuals persistently maintain that their vision is unimpaired. This phenomenon is referred to as anosognosia for blindness. The precise workings behind Anton syndrome and anosognosia for blindness are still not fully comprehended. Nevertheless, it is postulated that these phenomena stem from a disconnect between the damaged areas in the brain responsible for visual processing and other regions accountable for self-awareness and perception. Essentially, the brain reconciles the lack of visual information with an individual's sense of reality, ultimately leading to their denial of being blind. Anton syndrome underscores the convoluted and occasionally baffling mechanisms through which the brain analyzes and makes sense of sensory stimuli. It imparts valuable knowledge about the intricate interplay between different regions of the brain and their corresponding functionalities. Your healthcare provider typically commences the diagnostic procedure by performing a physical examination to determine your condition. They may assess your visual awareness and discuss your sight to determine if you can track light with your eyes. If there are indications of Anton syndrome, an urgent investigation is likely to be ordered, including imaging tests to examine potential occipital lobe damage. The appropriate approach to treating Anton syndrome hinges on identifying the specific factor responsible for occipital lobe impairment. In rare instances where brain damage is a consequence of multiple sclerosis, treatment strategies will primarily revolve around managing and alleviating symptoms associated with MS. Intravenous administration of methylprednisolone may be employed as a potential component of this comprehensive therapeutic approach. Should Anton syndrome manifest due to a stroke, therapy would concentrate on safeguarding against additional harm caused by subsequent strokes. This might involve implementing medications like daily aspirin or statins and effectively managing risk factors such as blood pressure and glucose, blood sugar, levels. The potential for enhanced vision due to treatment